Hi everybody, my name's Simone Walker and I'm one of the Deputy Secretaries here at Department of Communities and Justice.
And I'm Joanna Quilty, the CEO of the New South Wales Council of Social Service.
We're going to take the opportunity to talk to you a little bit about some of the issues that are being raised around COVID-19 and some of the questions that the sector has put to both Joanna and myself.
Thanks, Simone. Could we give some further advice about contracts and particularly in the TEI space?
Thanks, Joanna. Any security that we can provide for people is our absolute priority at this time. So where contracts are close to being signed, as I mentioned last week, I'm keen for that to happen. If for some reason that's not possible, we are really happy to roll people's contract over for the next 6 months. What we're trying to really aim for here in this very unusual environment is total flexibility. We don't want to rewrite contracts to make sure that we're including special activities that are happening at this time. We are trying to take a future focus and we want to do what really works for people. So we're really cutting back on reporting requirements and also making sure that the DEX data input remains in an optional phase.
I think another issue that has caused some confusion relates to the recent announcement that more than 2 people can't be together in terms of social gatherings. People are wondering, how does that apply if I need to go into the office, if I'm still working from the office and there's more than 2 of us there, or even if I'm doing a home visit to a client and there's more than 2 people in the home and I've got another worker with me. How does that fit with that new requirement?
So I can understand the confusion. It's really important to say that in workplaces, that's not the requirement, and even more so in our sector where our work is with vulnerable people, looking after them, taking care of them, that's not the requirement. But what we'll make sure is that we put some links after this video to more specific examples of how the public health information applies to our sector. But it is hard, I know, when federal government announcements come and worrying about what that's going to mean, because people want to do the right thing.
And look, in relation to that, Simone, I think the sector is really feeling that some clear guidance and protocols around issues like managing infection control and other really safe practices to keep both clients and staff safe are what's required, similar to what is available in the health sector and in the aged care sector. Are you able to say when those guidelines or those protocols will be available?
Last night, some specific protocols for our SHS services were released that looked at infection control. And we also have the links to the Safe Work Australia website where they've got a fantastic 30-minute induction piece about infection control. What we'll do is look to make sure that they're absolutely applicable to the sector. So we'll have a good review of that, but I would direct people to those resources and we'll also include some links.
We did mention just before about home visits, and I wanted to raise with you information that I'm hearing where DCJ and NGOs have done joint visits to families, but that we're hearing DCJ in some districts is pulling back from that and saying we will no longer do those visits, but we still expect the NGO to do the visits. So, you know, that does seem somewhat inequitable, and I'm so interested in your advice on that and what should be happening.
Thanks so much for raising that. And what I commit to is coming back with more information. So DCJ are still visiting people as required, doing good risk assessments and making sure environments are safe. But I know particularly for Brighter Futures providers that there may be some concern that there are different rules being applied. So we'll come back with that information as soon as we can. Also to get a consistent response, because I think that helps when people know that across the state there's the same position.
And I think it would be really good to start thinking about the fact that more services are moving online and looking at how they can use technology to reach out and still provide support to families. But how do you do that in a way that is good practice, and how do you make sure that you're still keeping your eyes on the child and ensuring that they're in a safe environment?
I think it's a really good point that we know working digitally or over the phone with families is sometimes a different skill set for people. So we're looking at a range of resources that we can make available both to the sector, but also to DCJ workers so that they're really optimising those opportunities.
And even the resources of the Office of the Senior Practitioner and having communities of practice might be an idea to pursue.
I think that's a great thing. The Senior Practitioner has a lot of value to add in this space, and we're looking at making sure those resources are available to the whole sector.
So just one other issue. I have had a long list today, I know that. But access to technology. For some NGOs and indeed for clients, they just do not have access to technology, so they're not necessarily able to access services remotely. And this is making it hugely challenging in the current environment. One idea that has been put forward is that where a service may have some unspent funds at the end of the financial year, is it possible to use that in a brokerage capacity to purchase technology or equipment for clients, or indeed to purchase technology for staff so that they can work remotely?
I'd strongly support either of those options. I think that that's a great future thinking way to address some of the problems, and really means that we can provide the services that we need to our clients right now. I just wanted to take the opportunity to mention some of the really innovative things that are happening. As people will know, there are going to be close to thousands of people in hotels in the city in the next week or so who've returned from overseas. And many of our TEI providers are providing parenting support to those families who are in those hotel rooms for 14 days with all ages of children. This is the work that they would do normally as part of being a TEI provider, but just in a different way with a client group that happens to be in one place. So a huge thank you to those providers and a great example of the flexibility of the TEI sector. So a huge thanks, Joanna, again. I think it's really great for us to continue these conversations, and I look forward to feedback from the sector.
Thank you, Simone. I think it's proving to be really useful, and I'll look forward to doing it again next week.